The Ministry of Health is advising the public of fake memorandums bearing the ministry's logo, one of which claims that all schools across the country are to be closed for a period of 2 weeks, effective today, due to a recent detection of hantavirus cases across several communities. Minister of Health Lakram Bodo is urging members of the public not to share or disseminate the inaccurate information.
I want to condemn in the strongest possible way an earlier purported release from the Ministry of Health, which is entirely fake. And as we speak, I'm seeing another release purportedly from the Ministry of Health, which is also fake. One speaks to the closure of schools for 2 weeks. That is certainly not so. And the other speaks, there's just come to my attention about the national shutdown, airport closure, and whatnot, and so on. I just want to say that this is absolutely not the case. There being no confirmed or suspected cases of hantavirus in Trinidad and Tobago. And again, I'd want to condemn in the strongest possible way the circulation of these two purported memoranda from the Ministry of Health, and to say that they're entirely fake news.
There have been 7 confirmed cases and 3 deaths from the virus following an outbreak on a cruise ship in the Atlantic. Countries have been evacuating their citizens, with the 2 latest confirmed cases being a French national and an American citizen. The French national has at least 22 possible contacts, which are now being traced, and a total of 18 U.S. residents are now isolated at special facilities. Here at home, the health minister says the ministry is not considering any travel restrictions.
There's really no need for any additional measures at this point in time. There are always screening mechanisms at all ports of entry, and those measures remain in place. The WHO would have indicated, of course, that there's a cluster of hantavirus cases associated with a cruise ship, which is en route to the Canary Islands. So whilst our experience previously would be to be cautious, there is no need for any sort of panic at this time in Trinidad and Tobago.
The false news has spread far and wide, with media from another Caribbean country getting wind of the disinformation, prompting the Caribbean Public Health Agency to respond.
So this question comes from Carlos Atwell from The Nation in Barbados. He's asking, he is hearing that Hanta has been discovered in T&T. I'm guessing that's short for Trinidad and Tobago. Is there any truth to this?
As far as we're aware, we have not heard, or there's no evidence that we're aware of to confirm something like this. I just saw someone literally just send this. I was laughing because someone sent it, indicating that it has been discovered. But we are working with our ministries. The likelihood of this is very unlikely based on all that we would have said. We will, of course, make sure and investigate, but I want the media to know that there have been information, a lot of misinformation that has been going out, the likelihood that this may be misinformation. We will work with Ministry of Health to on this information that was just reached, that just came to us.
Last week, an international news agency reported that a St. Kitts and Nevis citizen had been exposed to the virus on the ship.
So based on this report, there is no suspected or confirmed cases in the Federation of St. Kitts. So I'm asking the media to understand that, as we go along.
Meantime, CARPHA maintains that hantavirus risk in the region remains low.
So they are typically born, rodent-borne, and transmitted through contact with infected rodents or their excreta. However, the current hantavirus outbreak linked to the MV Honduras cruise ship is caused by the Andes strain, which is the only known strain capable of limited human-to-human transmission. It is found primarily in parts of South America, including Argentina. Based on the evidence available, the rodent species that maintains this virus in nature is not present in the Caribbean, and therefore there is no documented established local route of transmission in our region. This rare human-to-human transmission usually requires intimate or prolonged exposure.
Rynessa Cutting, TV6 News.